Dr. Pejham, let's talk about your iPhone application for asthma. I mean, how is it used? Explain that to us.
Well, I've always had an interest in asthma. I have family members who suffer from asthma, and I always wanted to find a way that used the technology, which is the other passion I have, and my interest in asthma, and help people track and communicate their information better. I'll give you an example. When people come to see us in the office, I see them for 15, 20 minutes, and we listen to them and we see how they're doing. But that remains the 23 and a half hours others outside of my office that I don't know how they're doing. And the nature of asthma is such that sometimes a lot of people have problems at nighttime. Well, unless you go to emergency room, no doctor is available to see you 10, 11, or 12 o'clock in midnights at night to see how you really sound. And you may still be okay while you're coming to the office, or you may be undertreated. So I wanted to find a way with all the new technology that you can track your asthma all day long, as long as you want, whenever you feel like you want to track it. So after about 9 months of development and research, a good friend of mine who is involved with technology helped me put this iPhone application together, and we released it in January of 2010, and it was immediately well received. Hundreds and then thousands of people started signing up and using it. We started receiving emails from hospitals and physicians that they really appreciate this. And the way the iPhone app works is that the patient, of course, installs it just like an app. It's a free app on their iPhone. And once they start using it, that information, which has to do with their asthma severity, first of all, they know exactly what their asthma severity is, so they can know what medications to take, and they can easily transmit that information to their physician. So now your doctor has so much good information they can go by rather than just that one single visit. And that was what was missing in our office visits. I would have loved to have this information a few years ago that I could really help my patients. And now we're being asked to do presentations for hospitals overseas in Europe, where preventive care is a big thing, because hopefully this use of this application helps people not have to go to emergency room. They get better control of their asthma so that they don't get worse, and they can get ahead of the game and not get worse.
Let's go back here, because I personally not yet completely getting it. So is this are we talking about a recording device here? Because the way you breathe, you record it, or is there something you hook up which then communicates with the app? What are we talking about?
Well, the device is a tracking. You can think of it as a diary of your lung function. Asthmatics have a device called a peak flow meter that they blow into and gives them a number. And they're supposed to then cross-reference some paperwork and see where they're at, what their usual is. So the device does that all for you. All you have to do once you put the number in, it immediately tells you how bad your asthma is, from good to moderate to very severe. And knowing that helps you know, hopefully your doctor has told you for which severity you need to take what medication. And as you're doing all this information gets saved anonymously, so there's no identifiable information until you decide to send that information to your doctor. And your doctor gets an email, or could be also in the form of a fax, and then they look at how your asthma has been doing the past, whatever you want to send them, and then they can better say, well, you know, I noticed in your record that you're having a lot of nighttime problems, so let me adjust your medications. And I've done this numerous times for patients, and it has really made a big difference. These were kids that just kept having this cough that woke them up in the middle of the night. They didn't really complain about it, but they had the same sleep problems that affected them during the day, and it was a very simple fix. Or they just weren't as active, but they didn't really complain about it. They stopped playing, not knowing that it was just because their asthma didn't let them play. So a minor adjustment in their medication made them be active, not be obese, get out there, play, and enjoy life.
So if you have an asthma onset or whatever, so what you do is you blow into something which measures it, which gives you a number, which you then put into that into your app.
That's right.
And that thing you blow in, that's something patients with asthma already have at home. It's already...
Most do, or it's a $10 plastic little tube that most asthmatics should have in their tubes called a peak flow meter. We give it as many as we have for free to our patients to use. And most asthmatics have been asked, that's the way you can have a measured amount of your lung function, and it's a good way to just to see how you're doing. It's not meant to diagnose asthma. Yeah. It's more to see the level of your current asthma at the time.
Correct. Well, it's a little bit like they have this things they put in for your heart, because it's difficult for the doctor to see your irregular heartbeat when you're with him, when there is no irregular heartbeat, but you have it like 20 times a day, just not when you're in the office. It's about like that, right?
You're referring to a Holter monitor, and that's exactly what it is, because the doctor's listening to you, and, well, you feel great and no arrhythmia, but I last night I had that arrhythmia and I felt it. And you're given this device, you're just kind of continuous monitoring yourself for a few days, and hopefully it's monitoring while you're having a symptom that you can say, well, 8 p.m. doc, I had this symptom, and then he can go to 8 p.m. and look at it and say, oh yeah, I see what your problem is. So it's exactly the same thing now with asthma. You can keep monitoring yourself as many times throughout the day, just blowing into the device, and keep recording it so you can give your doctor a good picture of your overall asthma throughout the day, maybe different times of the year. And that gives us tremendous amount of information to be able to better come up with treatment suggestions for the patients who may be having their exacerbation in the middle of the night that we would not have known about it otherwise.
Beautiful. Can you make such an application for my car? Because every time it rattles and I go to the car mechanic, it doesn't rattle when I'm there. And when he says, I can't fix it, it doesn't rattle. I don't know where to look for.
Yeah, I don't think that app, I'm sure, is coming, but I don't think it's out yet.
Well, all right. Thank you for explaining that. And definitely it looks to me a very, very helpful thing, because, yeah, problems occur and you got to see what happens. And so now you can retroactive see what happened yesterday or last week.
It's a free application. It's called Asthma MD, and it's available on iTunes. It's a free application, and anyone who is interested in asthma can go and download it. And we have a website, asthmamd.org, about this app to see a little bit of a video demonstration about how it could really hopefully change their lives.
Beautiful. Thank you very much.
Thanks.